Today, we will have a session that will focus on spine examination. We have with us here today Mr. Ao, who has kindly agreed to help us with this video today. Good afternoon, Mr. Ao. I'm Dr. Louis. Nice to meet you. Can I have permission from you to examine your back today?
Sure.
Okay. Now, for proper examination of your back, we need to expose your back. Do you think if it's possible that you can remove your top?
Sure.
Okay, can you kindly face this wall? As you can see, Mr. Ao has several plasters, medicated plasters, attached to his back, and this indicates that he has pain at that level. We will start with observing the patient's back and describe any misalignment or scoliosis, any muscle wasting, or any asymmetry of the shoulders or the scapula. We will now look at the patient from the side. We check if the patient has any loss of cervical lordosis, check for any thoracic kyphosis, and check his lumbar lordosis. And now we get the patient to face the wall again on this side. We will now go on to palpate the patient's back. Before we do that, we will need to remind Mr. Ao that he should let us know if he has any pain or discomfort. Is that alright, Mr. Ao?
Okay.
So we will start by pressing along the spinous processes. Along the midline. And after completing the lumbar spine, we'll move on to apply pressure at the sacroiliac joints. And the paraspinal muscles. We will now evaluate the patient's lumbar spinal movements. Mr. Ao, can you kindly bend forward, please? As much as you can, with your knees straight. Okay, backwards, please. Sideways on both sides. We will now assess the patient's cervical spinal movements. Mr. Ao, can you tilt your head to your shoulders on both sides? Can we now bend your head downwards and backwards? Okay. And can you turn to look over your shoulders on both sides? We will now get Mr. Ao to sit on the couch to assess his thoracic rotation. Mr. Ao, please. Please turn to your right. Good. Your left. Very good. Now, can I get you to lie down? We will now perform the straight leg raising test. Mr. Ao, as I lift up your leg, please let me know if there's any pain or discomfort. Okay? So we will start with the right leg. Is there any more pain with dorsiflexion?
Yes, a bit.
Okay. How about this? I'm going to now lift up your left leg.
Okay.
And I'm going to pull down your leg. Any more pain?
No.
I'll now go on to perform reflexes of his upper limbs. Mr. Ao, can I get you to put your hands on your tummy? We'll start with the biceps jerks, triceps jerks, and the supinator jerks. On the left side, supinator jerks, and the triceps jerks. We'll now move on to assessing his knee jerks. We'll now proceed to do the ankle jerks. On the left side, we'll now assess the patient's toe dorsiflexion strength. Mr. Ao, can you push up your toes, please? Very good. We'll now complete the examination with examination of the patient's pulses. And we'll start with the radial pulses. The Dorsalis pedis pulses, and the posterior tibialis pulses. Okay, Mr. Ao, can sit up now. So thank you very much for your time today.
Welcome.